everyone. Welcome to this event for New York Climate Week. Good afternoon for those of you, and evening. Great to be here. We'll give folks a couple minutes to make their way in. Kinari, Jonathan, how are you both doing this morning?
A little tired. Had a rough night with my 6-month-old son, but otherwise I'm excited.
Very well, Ashley. Thank you. How are you?
Doing great.
Yeah.
Great. So good to start the morning with you both. Happy to see rainy season is coming back here to the Pacific Northwest. And yeah, just excited to see all of these events at New York Climate Week as we get ready for COP at the end of the year in November. There's a lot to look forward to and a lot of challenge to meet for sure. And in the background, I just want to give a shout out and a special thanks to Devin Schmidt and Devika Gopal Agi just for all of your support and helping us get this together. And yeah, just helping us manage the chat, questions that are coming in. And we'll talk a little bit more about a quiz and a surprise we have for you all.
A quiz.
A quiz. Get us started nice and early in the morning.
And you can actually win something with this quiz, I hear?
You certainly can. Yeah, a very, very special something. Great. Well, welcome again, everyone. It's so good to be with you this morning. Let's go ahead and get started. I'm Ashley Emerson, Chief Programs and Research Director at Health and Harmony. And, you know, as we continue to define, develop, and expand what it means to address the climate and nature crisis in all its complexity, it's really essential to learn from stories of existing successful and bright spots that exist right now and have the opportunity to influence positive and exponential change, especially after a year where we've just had disaster after disaster and challenge after challenge. We're excited to invite you into a talk this morning that is very much a bright spot. So I'm delighted to welcome Dr. Kinari Webb. She's the founder of Health and Harmony, and Jonathan Jennings, our executive director at Health and Harmony. So they're going to guide us in this conversation, and they're thinking around how we can be creative, actionable, and embrace justice as we address the climate and nature crisis in this decisive decade. 10 years, we're 9 years left. We have a lot of work to do. So Health and Harmony, if you don't know already, it's a unique award-winning organization that is really guided by global rainforest communities who design these remarkable solutions at the intersection of human and ecosystem health. It allows them to reverse deforestation by improving their access to quality health care, alternative livelihoods and jobs, and moving away from extractive livelihoods such as logging or mining. So Kinari is very fond of saying solutions exist to reverse nature's collapse and the climate crisis. Rainforest communities have the answer, but we just have to listen. So Kinari and Jonathan will speak with us about their journeys, trying to find a pathway for humanity to restore nature and combat poverty, improve livelihoods, and stabilize our climate. So Kinari and Jonathan, special welcome to you both.
Thanks, Ashley. It's lovely to be here.
It is. It's great to be here. And, you know, thanks so much. We're really honored to be a part of Climate Week, New York City, and with other like-minded leaders in planetary health. And for those of you joining us, good morning, good afternoon, good evening.
Great.
Yep. We imagine people might be joining from all over the world. So delighted to have you here.
Wonderful. Thank you both. So we'll hear from these two brilliant and inspiring people today. And to keep things exciting and interesting, we're also going to have a quiz because we all need a quiz. And the winner receives a signed copy of Kinari's new book that is coming out in the coming days, Guardians of the Trees. Kinari, let's get that book up there again. It is beautiful. It's inspirational. And I just want to share a quick quote from our friend Jane Goodall, who says, "It's a wonderful book which tells the story of how Kinari fell in love with a rainforest in Indonesia and how she worked to save it by listening and to involving the local people and improving their lives by providing medical facilities and so much more." So we'll have a quiz later, and the winner will win a signed copy. Maybe we'll have more than one winner. We're feeling very generous today. And just some housekeeping. Keep an eye on the chat down below in the bottom of your screen. We'll be sharing links to articles, etc. and some of the work that we'll mention during this talk. And of course, feel free to post questions, and at the end, we'll ask Kinari and Jonathan to answer them. All right, let's get started. Kinari, let's begin with you. You have had an absolutely remarkable journey, much of which is described in your new book. Can you walk us through the story of how you got here and how you've worked to center forest voices in conservation and health and planetary health?
Well, so I first went to Indonesian Borneo to study orangutans. And I was a very young 21-year-old alone in the forest almost all day, every day, following the orangutans. But in the distance, I could hear the trees falling, these giant, giant rainforest trees that can be like 22 stories tall. And when they hit the ground, it's like a little mini earthquake. And it just broke my heart. And I thought, what is wrong with these evil loggers? Like, how can they be making these choices? But over that year, I got to know many of these loggers and I listened to them. And what they told me really just shocked the foundation of my world, which was that they were often logging to pay for the most basic necessities of life, and most especially for healthcare, because they, were growing enough rice to eat, but when one medical emergency can cost an entire year's income, how do you get that cash? How do you get it quickly? And this was something I had never heard about in the dialogue about conservation. It was all, these are the bad people, we have to stop them, we have to arrest them, but that understanding without seeing us all as interconnected. And why did these communities have so few resources? Because they were stolen for hundreds of years through colonial history, right? And so I began to feel like this just isn't right. Like, we're losing the foundation of the health of our planet, which is necessary for the survival of the human species everywhere. And we're doing that because individuals don't have access to the things that they absolutely need. And how could I blame someone for cutting down 60 giant rainforest trees to pay for their relative to be able to have a C-section, right? Like, I can't blame them. That's the right choice. It's the choice I would also make. This year I had a C-section myself and I get hit by a huge bill. If I didn't have a big savings, what would I have done? I don't know, right? And of course I would have done whatever needed to be done. So I went to medical school and then I went back and I started a nonprofit called Health in Harmony, and I partnered with this amazing team of Indonesians. I wish some of them could be on this call right here with you right now, but they're actually evaluating a new site right now in Papua where we might expand yet again. And this model was so successful in our first spot, and we're now expanding around the world. And we will, actually, we work in Madagascar, we work in Brazil, and we have a second site in Indonesia and are likely to start a third. But that's not enough. We'll tell you about that.
Awesome. Yeah. Thanks so much. Something you said, about interconnection. I know this theme will keep coming up in our chat today. And so for us to all hold that dear as we have this conversation. Thank you. And Jonathan, you've had an incredible career as well, and your global perspective, working all over the world as an ecologist and practitioner who spent your career on the front lines, oftentimes managing crises. So what brought you to Health in Harmony?
Thanks, Ashley. So before joining Health in Harmony about 5 years ago, I spent about 15 years in leadership roles around the world with Doctors Without Borders, Médecins Sans Frontières. As you said, responding to crises such as famine in the Horn of Africa, conflict in Syria, and the Ebola outbreak in West Africa, all of which are driven directly or indirectly by environmental degradation and the climate crisis. So I left Doctors Without Borders to come to Health in Harmony. And the reason I left Doctors Without Borders is because I just got frustrated waking up every morning, going to work to deal with the humanitarian fallout of a sick planet. Our planet is the patient now. I firmly believe that. And our planet's vital signs aren't very good. In fact, they're not good at all. And so as you mentioned, before I left the US in the mid 1990s, I had a master's in ecology, and I was an environmentalist and a backpacker and a tree hugger. So that's in my DNA, that environmentalism. And I've known for a long time that we've never lived in a world where the health of people, the health of wildlife and ecosystems, and the health of the planet could be addressed in silos. Nevertheless, that's how we've been addressing them for the last century or more. So I had the great fortune of meeting Kinari. We spent some time together, and I joined, this awesome team who several of you are on the screen today. And we are, as Kinari said, we are now taking this incredible vision and this data-proven model to locations around the tropics.
Great. Thanks so much, Jonathan. And yeah, I love that. And it's so true. The planet is the patient. So really shifting our perspective, this is planetary health. You both are so inspiring. And so let's dig a little bit deeper into how you think about this work and in your practice at Health and Harmony. It seems like a lot of what you're talking about is a paradigm shift. And so I want to start with kind of a big question. And Jonathan, if it's okay, let's begin with you. How can we reshape global health? And how can we reshape conservation and even philanthropy to address the climate and nature crisis?
Yeah, it's so essential that we do that. Well, first, I believe that where the health of the planet is concerned, there are no insiders and there are no outsiders. We're all in this one boat together, and the boat is sinking right in front of our eyes. So we need humility. We need each other. And those of us from industrialized nations like the United States, we need to recognize that we are responsible for the lion's share of the climate crisis. And so we must be prepared to make the lion's share of sacrifices in the next decade. That's number one. Number two, we need to expand how we comprehend human health in order to build smarter health systems that incorporate our interdependence with nature. So the World Health Organization's definition of health as a comprehensive state of physical, social, and mental well-being implies our interconnectedness with nature. Yet global health practices for the past century or so have focused narrowly on the disease burden in one species only, us, humans, neglecting the fact that our health depends on the well-being of the ecosystems that we call home. So third and finally, Ashley, in order to operationalize this interdependence, we can start by admitting, and no offense to anyone on the call, but we can start by admitting that a global health industry that doesn't keep people healthy and a conservation industry that doesn't protect nature are probably not built for purpose, and certainly not built for purpose vis-a-vis the twin crises of the collapse of nature and the climate crisis. Working in silos hasn't worked. So practitioners of global health and conservation and other disciplines, I believe, and we all believe, should combine forces and unite to execute systems-oriented interventions like the ones that Health and Harmony implements beside rainforest communities and guided by rainforest communities. So across the tropics, Health and Harmony trusts the wisdom of rainforest communities to know how to reverse the loss of local rainforest. And these communities, when they build these solutions, they're quite naturally designing new systems that link their health, link their household economy, their jobs, and their rainforests. So these communities across the tropics are creating smarter, regenerative health systems, ones that make them happier and healthier, and also make their rainforests healthier.
And thereby makes the planet healthier. Beautifully said, Jonathan.
And thereby makes the planet healthier, exactly.
Yeah.
Great, Jonathan. Thanks so much. And yeah, I think this idea of our siloed approach, whether it's through philanthropy or health or conservation, is so often what's getting us into trouble. And it can be hard, to think through the complexity of these challenges, but that's how ecosystems work. That's how we function. And so really being able to wrap our heads around that. So Kinari, before I ask you that same question, I think what would be amazing is ASRI in Borneo is a really good example of this. Can you walk us through? I've had the pleasure of going to ASRI. It's an incredible place. It was a life-changing experience to be there and to see this medical center on the periphery of a rainforest Can you walk us through what this looks like tangibly in real life and that this exists?
So we have this principle that we call radical listening. And what it means is that communities who live around the forest, in our case, in our first site, very mixed communities from all over Indonesia, Indigenous and non-Indigenous, but all of them understand that their well-being is dependent on the local environment. And this is, this is something that is true of Indigenous people all over the world, right? This understanding of interdependence. And it is something that often is not, it's certainly not the way I was trained, right? I was trained as a doctor, I was trained, before that as a biologist, in these very, very siloed thinking. So what we do is we do radical listening and we ask the communities what the solutions are. So we did that all the way around this beautiful, amazing, giant national park. In all the communities, there's a population of about 60,000 people directly around the park. In the greater area, about 120,000 people. And every single community came to the same conclusion about what they would need in order to be able to protect the forest. Now, when I went to these communities, all I could see was problems, right? Water and sanitation and education and everything, right? But no, they said, look, if we had access to high quality, affordable healthcare, and we had training in organic farming, we could stop logging. I philosophically just trusted them. 10 years later, the impact of that was unbelievable. And Jonathan is going to tell you all the details of what happened. But these communities knew what the fulcrums of change were. They knew what the key things were, that if these things changed, everything else would change. And that is what happened. So how do we provide high quality, affordable healthcare? Well, one of our principles is all local staff. And so we hired amazing folks from very local and from a little farther away. And then, for example, like they needed training in organic farming. The next door island of Java has a many thousand-year tradition of organic farming. So we were able to bring experts over who could then work with the communities. Healthcare, we wanted to make it affordable and also sustainable and valued. And one of the ways that we did that is we allowed people to pay for their healthcare through non-cash payment options like seedlings or beautiful handicrafts made from sustainable things that they could harvest from the forest. And then you could even pay with manure, which we then used for the organic farming training. And then we also give discounts to communities. They designed this so that there would be a 70% discount if there's no logging, and sort of variable discount up to like 30 or down to 30% if there was still logging in the community. That discount was paid for folks who care about forest, who care about wanting to protect our planet. And it's a partnership. I call it when we first asked the question, we said, what would you all need as a thank you from the world community? Because I see this as mutual gift giving. These communities have something beautiful and exquisite to gift to the world, and they may need some help to enact the solutions that they know so that they can actually protect that forest. And so this mutual gift giving, and it was dramatically successful. I don't know, what else do you want me to tell you? Like all these amazing people, this incredible staff bicycling around, going to a little clinic and hanging out on the beach afterwards. It's a place with lots and lots of love and a great, it's a place of hope.
Yeah, that's wonderful to hear. I think we need more of these places of hope that can inspire us to engage in and embrace this change that we're being called to participate in. And I really appreciate our participants putting some questions in the chat. Kinari, a question came up while you were chatting from Nick, wondering why organic farming? Is there something specific or particular about organic farming versus conventional that was important?
It was really, really surprising to me that that's what the communities identified. It's something I never would have guessed in a million years. But what they said was, look, our traditional form of agriculture is slash and burn, right? Where you cut down some forest, you plant a crop of rice, and then you keep moving. And they said, look, that system worked great when we had lots of forest and not many people, but it doesn't work for us anymore. And we are heard that there are other places in the world where people know how to plant in one place without having to buy these crazily expensive chemical fertilizers. It turned out later, we found out people were actually having to log to afford the fertilizers to plant their rice, right? So that's like, again, one of these horribly destructive cycles. And they saw that if they could just learn that technique, they would do well. And in fact, at our 5-year anniversary party, one of the village chiefs said, you know, that road along here, which used to just be all, you know, just destroyed land, is now beautiful rice fields, and they are making the fertilizer from, he called it, from the trash around them, right? So it's like all of the, you know, they learned how to make compost and it works great. So.
That's great, Kinari. And from what I understand, so you start with radical listening. The community designs these intersectional solutions. You immediately find support to invest in those solutions, overlay it with programs like non-cash payment or conservation contracts, and those things really help bring the model forward. Can you talk a little bit more about the nature of radical listening as the years go by and as the needs change and what that's looked like?
Yeah, so that organic farming example is a good example because when we first started, there was no use for manure. People didn't know you could do anything with it. It had no price. But then as soon as we started doing this training, suddenly there was a price for manure, and then it became expensive, and then people were hoarding it. No one would even sell it because it was so valuable. So then we had to go back to communities. Radical listening is not a one and done. It is a constantly iterative process. So this new problem arose. So then we asked them, you know, how do we solve this problem? And the solution that was come to was, well, we need some more animals in the community. And which there were very few for a lot of reasons, mostly poverty. So we did this new program. They designed it called Goats for Widows, where the most vulnerable members of the community, the widows, and those who are usually the poorest, would receive these goats, and then they could sell the manure and they could sell baby goats as well. So that was, it's been wildly effective. Yet again, they figured out exactly what the solution should be. So, yeah.
That's wonderful, Kinari. And you know, at some point when we can travel again, and we'll likely travel a lot less than we used to, it's a place where you can go and you can learn and you can train and you can understand from these planetary health experts how to do this, you know, whether it's in your own backyard or through your organization. Health and Harmony also offers training in radical listening. So a wonderful opportunity if this is a tool or methodology that would be helpful for your work. Jonathan, thanks so much, Kinari. And Jonathan, I want to turn to you now. So in Indonesia, in Sukadana, we understand the communities, you know, had this challenge that they were facing. They needed money to pay for healthcare. They needed new livelihoods. So many of the pressures on them and on the forest were internally focused on the community. But as I understand it, in Brazil, many of the pressures on indigenous and traditional communities there are very external. Can you talk to us a little bit about those external pressures, and are there any similarities in what you've seen as programs have grown there?
Yeah, great question. So the similarity is healthcare. Let me come back to that in a second. As you've mentioned, both of you mentioned, in Indonesia and in our Madagascar program, it is more of what I would just oversimplify to call like impoverishment and a lack of livelihood choices that is forcing the communities that we work beside into extractive behaviors, into logging, into poaching, into et cetera, mining, that kind of thing. It's slightly different in Brazil. In Brazil, where we work in the Xingu River Basin, which is the Green Shield, which Kinari can talk about a bit later, these forest peoples, these local indigenous and traditional communities that live in this part of the Amazon and in the Amazon broadly, they are the first line defenders of the forest. Their very presence in the forest is darn near close to a guarantee that that forest will not be encroached upon externally by land grabbers who want to deforest that land and cattle ranch or start agribusinesses like soybean farms. Okay, so the point of our work, the objective of our work in the Xingu River Basin is actually to keep these people on their land, right? Because what happens is when they get sick and they are forced to take a 10-hour boat ride to the nearest medical facility, that leaves the land behind them vulnerable to external land grabbers, encroachment.
Even more so if they die.
And even more so if they die. And so what is the similarity here? It's healthcare. All three of these communities in Borneo, in Southeast Madagascar, and in the Xingu River Basin in the Brazilian Amazon, they have all identified access to affordable quality healthcare as sort of the anchor of their ability to live in balance with the forest. Now that means slightly different things, which I hope everyone can understand after my explanation quickly of the contexts. But the anchor here across these communities has been healthcare. But healthcare is only an anchor if you're administering healthcare without the livelihoods component, without the forest economy component, without a conservation component, and without linkages between these elements of the system, then you're still operating in a sector-based, silo-based approach, and it's not generating the more fulsome impact, or what we call the planetary health impact, which we can talk about a little bit later. But Ashley, just to answer your question and to summarize, it's incredible how these communities, these three disparate communities, are identifying healthcare as the anchor to their ability to live in balance with the ecosystem.
Yeah, that's great. That's really, really helpful. And Kinari, is this what you are seeing and imagining is happening pan-tropical?
Well, we haven't been anywhere yet, and we work in these locations, but we've also evaluated a lot of other locations, and we've worked with partner organizations, and they've done radical listening. Jane Goodall, I had an amazing conversation with her, and she talked about how they also listen to the communities where around all the forests where the chimpanzees are. And again, it's that need for healthcare is such a prime driver. And it's understandable because it's so expensive to access care, right? Even in a place like Brazil, where healthcare is actually provided free by the government, but in very, very remote locations, it's effectively inaccessible, or it costs so much money to be able to get it that, you have to travel really far, you have to stay in the city, you're lost income. Those costs all really, really add up. And when you need it, and you'll do whatever it takes to get it, right? And you can't blame anyone for that. It's exactly it's what any of us would do. So right. It's just so essential that we honor these communities who have something so incredibly precious and valuable to give as a gift to the world.
Right. Yeah, that's so important, Kinari. I have one more question for you before we jump into our quiz. So to our panelists, get ready. We have a little quiz for you. Exciting opportunity to win one of the first copies of Kinari's book that's coming out. Jonathan and Kinari, we are in a global pandemic. We're still in it. It's still very hard for the communities in which you work. The healthcare systems are fragile. It's been difficult in so many ways. Knowing that healthcare is such a critical element of forest protection, what has Health in Harmony done to address the pandemic and respond to communities in this really difficult time?
JJ, you want to jump in first?
Well, sure. I would say, luckily, I'm blessed that my worldview has really been defined by my many years with Doctors Without Borders. And that's number one. Number two, I'm very lucky that my colleagues here on the screen also have that DNA. Like, challenges are meant to be overcome. And I think during this pandemic, Ashley and Kinari and the rest of our team, a year and a half ago, we sat and we looked at each other and we said, this is our time. If this is a planetary health crisis, and this is the moment for Health and Harmony to react instantly beside the communities with what we now sort of simply frame as a response, a medical response to an infectious disease outbreak, which would look very much like a Doctors Without Borders response to a disease outbreak, plus this brilliant thing that Ashley, give you the credit for this, that you designed, which was working with communities in Borneo and Madagascar, and more recently Brazil, but to design what we now call a rainforest stimulus package. So we, number one, react, action orientation. We've got to be beside these communities now. They're suffering high mortality rates. Their local economies are collapsing. And the combination of those two things is going to force them back into the forest to extract. And when they extract, they cut down trees. And we know the impact of deforestation on the climate crisis, global heating, and not to mention the loss of nature and the loss of biodiversity. So we just—
and the risk of further pandemics.
And the risk of further pandemics, exactly. So we doubled down and we just acted as quickly as we could, but within the unique framework that I believe Health and Harmony brings, which is that planetary health frame, which is to say that it's not quite enough just to do a medical emergency response out of Osri's health facility. It's not enough just to do medical emergency response to epidemic outbreak in our Madagascar program, in the health facilities we're supporting there. We've also got to work with the communities to leverage the livelihoods, to recognize the fact that their access to local economies was collapsing. So how do we bolster them? How do we offer them resilience? And I think, Ashley, it was a stroke of brilliance what you designed, this rainforest stimulus package, which was working with the loggers, the former loggers, and the community members, offering them forms of stimulus, economic stimulus, which I can let you describe, in combination with the medical response.
Yeah. I don't have anything more to add to that. That was great.
Okay, great. Jonathan, thanks so much. I mean, it's helpful to see, that at a time when it feels like there's so much loss, there's so much challenge, it's incredibly complex, and it continues to come in these waves that we're all experiencing, that there are comprehensive systems that are supporting communities, their healthcare, the emergency needs, and their livelihoods for their families and for their well-being. So thanks for the credit. It's really the communities. Can you go ahead?
I do actually want to add something. One of the things also that was very powerful in this moment of the pandemic was how we've worked together with the governments. So we've always had really good relationships with the government, but boy, in this crisis, they really called on our teams in all of our locations. And really, we were able to work very closely together. In Brazil, that meant these trips really into these crazily remote communities. I mean, it's like this region, that the Xingu Basin is as large as the UK and has a population of about 20,000 people, right? So it's like massively spread out. And we had to bring immunizations to all of them. And COVID had gotten up into these communities, right? So this was definitely necessary. And also we wanted to, the hospitals in the cities were collapsing, right? They were completely full. So we wanted to help, we knew that it wasn't really an option for people to come to the city. So getting them immunized and getting oxygen up into the remote communities saved many lives. And the same in Indonesia, actually, amazingly, our previous executive director, Dr. Monica Nirmala, she actually just she's now like the second in command at the Ministry of Health. And she's, I just talked to her last night, and she just went to the G20, and she's like helping them think about things from a planetary health perspective. So there's these synergies that we hadn't really imagined, to these levels of like working together with the government and really beginning to shift the paradigm, and in Madagascar as well, and really helping them think differently about how to approach a medical crisis as not just a medical crisis, but also potentially an environmental crisis. Because when the economics get worse, people are often forced to do more extractive work.
That's so helpful, Kinari. And Nick in the chat had a great question, which was, what are some of these economic stimulus concepts? And so one example, Nick, was, folks whose systems of distribution were cut off from farming, who couldn't continue to make money on their farming, were able to set up seedling nurseries in their backyard, be paid per seedling. So it's not only an immediate economic stimulus package that goes right in their pocket, it also helps prevent future pandemics through reforestation, through ecosystem integrity. So programs like that we found to be really helpful, and we just wish that there were more of those versus the 190 billion that was put toward bailing out oil, gas, airlines, et cetera, in the G20 nations. So again, paradigm shift is so critical. All right, now for the fun stuff. Let's jump into the quiz. Devin, thank you so much. We have a quiz for you all. We'll announce the winner in the next couple days, or winners that we have. In just a moment, you'll see a quiz pop up. So feel free to put your answers in there, get your brain going. Hopefully everybody's had a cup of tea or a cup of coffee, but some great questions in here. Thanks so much, Devin. And while folks are filling that out, we are going to keep going in our conversation. So, Jonathan, I want to turn to you to really talk about impact. We love inspiring stories, we love messages of hope, we love bright spots, but at the end of the day, we need impact. We're not seeing impact in the news. We're not seeing impact as we see these continued environmental crises ahead of COP and the IPCC report that just came out. The NDCs that countries are contributing is not getting us to where we need. Tell us about some impact that would inspire us from Health and Harmony's work in Indonesia. Can you walk us through that?
Sure. So Kinari described her first program, which started with her Indonesian colleagues and co-founders in Indonesian Borneo in 2007. And she described the process of hundreds of hours of radical listening. And she described how communities concluded through these hours of radical listening that they could live in balance with their ecosystems if they had access to affordable quality healthcare and training and alternative livelihoods as sort of the two main elements of the system that has since been built. So that's exactly what Health and Harmony did in 2007. We trusted their guidance and we began investing precisely in their systems-oriented solution. As Kinari said, we established a medical clinic on the edge of the rainforest, and we initiated jobs training and alternative livelihoods, mainly in organic farming, as we've discussed, in order to justly transition loggers into safer and better paying jobs. Okay. We know that the communities were right. And Devin, if you could just show the slide, everyone, I just have one slide. I just know that it's better to put numbers up in front of you as I speak. We know the communities were right because we gave the first 10 years of program data to researchers at Stanford University. And their analysis culminated in the publication a few months ago of our 10-year impact in the proceedings of the National Academy of Sciences here in the US. So researchers found that between 2007 and 2017, Health and Harmony's investment of $5.2 million into the community design solutions resulted in some pretty remarkable things, including, first, a 90% reduction in the number of households reliant on logging for their livelihood. Now, this reduction in logging prevented $65 million worth of above ground carbon from being released into the atmosphere. So that's thousands of tons of carbon that aren't in the atmosphere, creating more heat for the planet. And this reduction in logging allowed 50,000 acres of forest to grow from denuded land into viable secondary forest, 50,000 acres, which is obviously critical habitat for biodiversity that is just overwhelming in Indonesian Borneo and across Borneo. The sort of the flagship and maybe the most recognizable species from this forest is the critically endangered Bornean orangutan. About 15% of the world's remaining population of the Bornean orangutan lives in this place where we work. So their habitat is being expanded and protected. Now, finally, from a human health point of view and a human well-being point of view, infant mortality fell 67% in the hospital's catchment population of about 120,000 people. And there were significant declines over time in diagnosed cases of malaria, tuberculosis, and diabetes. So I want to stop there and zoom out a little bit. What did Health and Harmony do? Well, really just two things. Health and Harmony restored agency, restored decision-making and control to these communities. We have been guided by these communities' scientific and cultural design. That's number one. Number two, we invested precisely in their solutions, right? We bridged wealth from other parts of the world back into their solutions. So we have restored agency and we are facilitating the transfer of global wealth back into rainforest communities' solutions. So our work, and this is in the words of the Stanford researchers, this work demonstrates an operational framework to simultaneously achieve multiple sustainable development goals, okay? To simultaneously reduce poverty, improve the conservation of nature, and improve human health, not to mention education and women's empowerment, which we could talk about if desired. So that's clearly a bright spot, right? It's clearly a new paradigm, restore agency, transfer wealth into these communities who are the experts in knowing how to live in balance with their rainforest ecosystems. Now, why is that important for me in Portland or you in Toronto or in Tokyo? Because the health of a rainforest half a world away matters to my health and my family's health wherever I am on the planet, right? So we're replicating the model beside rainforest communities in Southeast Madagascar and the Brazilian Amazon, as we've talked about. And today we're scaling our impact by persuading governments and corporations and multilaterals and other NGOs to invest in interdependent, systems-oriented planetary health approaches like ours, and to be guided by the local experts, right? Let the local experts guide our investments. And so this is something that Kinari is working diligently on, leading our team in the development of a technology application to accelerate this scaling impact that we are hoping to achieve in the next 9 or 10 years.
Great, Jonathan.
So
it's so good to hear.
I'm just going to add just a tiny little bit, but then when I talked about this being like mutual gift giving around the planet, I just want to be really clear that the world gave gifts to these communities precisely under their direction and control. But the gifts that these communities gave back to the world were many, many times greater. Right? This is actually how mutual gift giving tends to work. It's like exponential. Right? And that's what we want. And this is really significant. I know $65 million is it's hard to put your mind around it. The amount of carbon in Gunung Palung National Park is equivalent to 14 years of carbon emissions from San Francisco, right? Like this is really, like, it's great if I drive an electric car or ride my bicycle, et cetera, but that is nothing compared to what these rainforest communities can give to the world.
Yeah, thanks for putting that into perspective, Kinari. So nearly a 12-fold return from these communities on carbon alone, which is amazing. So we have
right, and we don't want a value forest just for carbon. That's the other important thing, right? It's about water cycling. It's about beauty. It's about cultural value. It's about health. It's it's about the biodiversity. Like we don't want to just limit. And in fact, I almost even hate citing that data because I don't want us to just think about these forests as important for carbon. They're important for so many other things.
For sure. So we have a question that has come up from PH and Chang, really wondering about leakage. So what happens when you work with communities and they 90% of them transition away from logging illegally. What's to stop logging concessions from sending other people in? Can either of you respond to that question?
So the first thing I'll say is that this is not actually logging concessions, right? So that is an issue in other parts of the world. It is not so much an issue around Gunung Palung. So this is protecting this national park, which has already been agreed by the government to be protected. It is illegal to log in it, but it definitely was happening to a very, very, very large degree. So these folks who have stopped logging have actually totally stopped. We know because we know them individually, right? They have shifted their livelihoods. And now we have a new program also called the Chainsaw Buyback program. So because we do also want to, many of these folks who stopped logging still own their chainsaw. And then some people were still logging, that 10% remaining folks. So we started this Chainsaw Buyback where we would help people, them and the logger and their wife, tend to be men who log, but so would both start businesses. And then their investment in the business was their chainsaw, and we would invest more money. And then once the business was successful, we would consider it just their business. So sort of a jointly owned business in the beginning, and we could help support them in that business. But that's also been wildly successful. And then we have the chainsaw, so we definitely know that it's not continuing to be used.
Great, thanks so much, Kinari. So before we jump into questions, there's some great questions coming in. Thanks, everyone. We hope to get to all of them. If we don't, we'll follow up with you. It's great, again, to hear the story of impact that you've replicated and grown, but what about exponential impact, which is what we really need right now, given the climate and nature crisis? Kinari, can you talk to us a little bit about how do you think about scale? How do you think about exponential impact?
Yeah, so I think, wow, this program was wildly successful, and it's helping protect 14 years of carbon emissions from San Francisco, and that's not nearly enough. If we lose our rainforests, this is something that people are not really thinking about when they think about the climate crisis. They tend to just think about burning of fossil fuels, which is also absolutely important, and I'm super excited that many people are working on that problem. But if we lose our rainforests, it's just game over. It's game over not only because of the amount of carbon that would be emitted if these forests burned or were logged, but also because these forests suck down carbon from the atmosphere. They are part of the solution as well as a potential cause of a problem if they aren't thriving. So when forest is thriving, the planet can thrive. But in order for the forest to thrive, the communities have to thrive. And lots of them have to thrive. And so we are trying to figure out how to scale this model as quickly as possible. And that means using technology. And it means having radical listeners all over the world listening to communities and then having their solutions matched with the global resources that can enact those solutions and can enact them quickly, because this is one of the most impactful things we can do. And I want to be clear too, it's not just about saving forest as the forest keeping, we don't want to lose any more, but it's about that regrowth too, which also sucks down more carbon from the atmosphere. So we're designing what we're calling the Rainforest Exchange. And this will be a place for people like you all to be able to partner with communities and help enact their solutions and to be able to see the impact of that partnership. So let us know if you want to be notified as soon as it's live, and we would love to have you all try it out and see and give us feedback. So I don't even know, how do they do that?
A great place to follow is our website. That's where you'll get the most up-to-date information. Social media, if you're on there, it's also a great place where you see a lot of overlap and calls to action. So Kinari and Jonathan, I'd love to jump over to a few questions in the chat before we close out here. And one of them that came up recently from PH, who's joining us today, is how does Health and Harmony respond to the increasing threat to Indigenous land rights? It's a big challenge for communities, as we've seen. Which of you would like to take that one first?
You want
Go
to
for it.
Jonathan?
You go for that. You take it first and make it easier for me.
So, yeah, this is an enormous issue, right? So, and it's particularly an issue in places like Brazil. But what we found in the Xingu Basin is that working closely with the local government and working closely with the local communities, there's a lot of work that can happen to strengthen communities and so as Jonathan said, when they are on their land, that really helps protect. And what is not known is that like 60% of Indigenous people are not actually living on their ancestral land. And many of the reasons for that are lack of education opportunities and also lack of healthcare. And there are a lot of other factors, of course, but this is some of the things that these communities have asked for so that they can stay on their land and thrive there. And we are working very closely with them that they will design the solutions, not us. So, yeah.
Well said. I have nothing to add. It's an extraordinary challenge, land rights and the legal rights. And yeah, nothing to add to what Kinari has said.
I'll just also add that there are organizations like the Tenure Facility. I'm close to the woman who's the executive director of that, Nanette Royo. And this is wonderful work. We want this work to happen. And then there's this other level of work. Like she says, yes, tenure is so important. And it is essential that we protect these lands legally, but that is not enough. That without support to these communities to be able to stay on their land and thrive there, that often isn't, it doesn't work in of itself. It's necessary, but not sufficient.
Mm-hmm.
So.
Yeah, a lot to be done for sure. And I know advocacy is a big part of that, whether it's in Brazil or here in the US. And I know Health and Harmony is very engaged in those efforts. We have another question from Radhika, who's asking, what do you consider to be the largest obstacle as far as sustaining these healthcare systems and providing healthcare to local communities is concerned? So Jonathan, I'd like to kick this one over to you. And then the second part of that question is, has there been any tension between local governments and the work being done by Health and Harmony alongside these communities?
Great. I can start with the first, and perhaps Kinari, you can take a stab at both of them. The biggest obstacle, it's not the communities, it's not local government. It's the the entrenchment of the paradigm that we are looking to bend and replace, if I'm honest. And it starts with multilaterals. It goes through the bingos, the big international organizations, governments. We are exceptionally good at working in silos. We are exceptionally good at looking at life and looking at societal sort of the features of our societies in silos, apart from, right? So global health, apart from the conservation of nature, apart from agriculture, et cetera, et cetera. I at the risk of sounding immodest, I don't think our current institutions are built for purpose vis-a-vis the twin crises of nature's collapse and the climate crisis. So the biggest obstacle, it's not in community willingness, it's not in political willingness at the local level, it's simply creating a critical mass of change agents who understand that we desperately need these experts in these forests guiding the investments towards nature-based solutions, right? So we desperately need to restore agency, understand how they would live in balance with their rainforest ecosystems if only they had access to, right? In our cases, affordable quality healthcare, training, and alternative livelihoods. But donors, philanthropy, government, non-governmental practitioners, the private sector, we're still talking about silos. We're still talking about the elements of the system and investing only in those elements. When you talk to humans, and they don't have to be from the global South, right? Anybody on this call, if somebody were to knock on your door and ask you how to solve a local problem, your solution would never be about one sector or one silo. It would be a system. And we've got to change the nature of, whether you call it the international development industry or the conservation industry or the global health industry, we have to change the nature of our approaches. And one of the things we label this as is operationalizing interdependence, right? Our interconnectedness. We have to operationalize that. And the irony, or I don't know if it's an irony or paradox here, is if you are investing in systems, if you are seeking win-win or win-win-win, I think there's a prevailing idea that that's too complicated. Complexity is too complicated, right? It's too expensive. Well, what we're finding is actually, number one, it's working. And that's already a counterpoint to 50 or 60 years of international development, global health, conservation industries that you could debate, but arguably aren't working if during their existence we've engineered the collapse of nature and a climate crisis, right? Something's not working. So I think it's confronting the existing paradigm and just changing it within any institution, right? Like no institution that I'm speaking with is built to think and operationalize and invest in systems, right? And so I know it's a bit of a pointy-headed sort of boring answer, but it's not funding, right? That's what you would expect me to say. These communities just need more funding. Well, that is true, but that will happen when the paradigm shifts in Jakarta, in Tokyo, in Ottawa, in New York, right? We really need all elements and entities in society, governmental, non-governmental, private sector, to understand interdependence and to understand that if we don't get our act together, it's game over. It's too late, right? So I'll just stop there. And Kinari, I forgot the second question, but maybe Ashley.
I got it.
You got it. Okay, go ahead, Kinari.
So I just want to answer this question from a slightly different perspective, though, about the healthcare sustainability. So the hardest part often on the ground is having physicians who are willing to stay in these local communities for long periods of time. And one of the ways that we have been very successful at our sites in doing this is the young doctors are so excited about a program that is also addressing the climate issues and also addressing rainforest and working in a really honoring and, respectful way with the communities. They're not used to that and they love it, right? So, and we do find we have turnover, but that's okay. And again, just to note, all the staff in Indonesia, 100% are Indonesian. All the staff in Madagascar, 100% Malagasy, and same in Brazil. Well, they're not Malagasy in Brazil, they're Brazilian. So, and then you asked if we have tension with local governments. Sometimes, yeah, right? It's, we have a fabulous, amazing woman we work with, Padni, and she's kind of an anti-colonial expert. And she said, one of the things about being anti-colonial is to be careful how you work with governments. And we do walk a very fine line of always honoring and respecting governments, and at the same time, never putting the community in any way in any danger. And sometimes that means that we aren't sharing data, right? And we're very clear with the community and we're very clear with the government that we will not tell them who the loggers are, things like that. Yeah.
That's great, Kinari and Jonathan. Thank you both so much. We have a number of questions we didn't get to, so apologies. I know, Elizabeth, your question is very important about adequate access to vaccines. All the communities we work with, we have fought and worked incredibly hard to get vaccines upriver and forest, wherever they can be to help prevent the spread of COVID. And we also know global distribution really isn't set until 2023. So there's a big role we can all play in advocacy around the inequity of vaccine access. So thank you for your brilliant questions. If you're curious to learn more, Kinari will be on another panel this afternoon at 12 o'clock Pacific time, alongside Aaron Bernstein and Hindu Omaru Ibrahim, talking again about planetary health and addressing catastrophic environmental threats to human well-being. So please tune into that. And then we have a team from Health and Harmony and some of our colleagues from Brazil who will be at COP26 this year as an observer organization. So meet us there, find us there. We would love to connect with you. We would love to support your efforts as we really advocate for the integration of health and global health in the climate and nature crisis. Jonathan, Kinari, thank you so much. Kinari, congrats on your book. We're so excited for you, and congrats to the winners who will receive this book in the mail before too long. Hope you all have a great day. Take care of yourselves. Be well.
Thanks, Ashley. Thanks, everyone. Cheers.
Thanks. Take care.